Welcome to CIC for beginners. You're probably watching this DVD because you're just starting to self-catheterize. When you're having problems emptying your bladder the traditional way, CIC is the best option. Doctors consider CIC to be the best practice for people who have trouble emptying their bladders. It's been the medical standard for many years, and people all over the world CIC every day. Many more than you might think. You're definitely not alone. CIC itself is nothing more than inserting a small tube, the catheter, into the urethra, reaching the bladder. The urine flows down the tube and out. There are other ways to empty the bladder, but CIC is the most convenient method. It can be done anywhere you would traditionally empty your bladder, which means you can travel or work or just get on with your life with one less thing to worry about. Just as important, CIC empties the bladder completely and effectively when performed with the proper technique and equipment. Important in helping you avoid infections or other complications. Many people with limited mobility or coordination CIC regularly. Children as young as 5 learn to do it. And with little practice and our tips, it'll become second nature. It really does get that much easier. First things first. When you're just starting out with CIC, it can seem difficult at first. You have to get used to it for one thing, and you have to develop a technique that works best for you. But most people who CIC do it 5 times a day. You can imagine, it will come naturally in no time. With the right catheter and instructions, which you probably already got from your healthcare provider, CIC doesn't hurt. But because you're not used to it, you'll probably react to the pressure of the tube as it's inserted. It's not painful, it just feels weird the first few times. I probably don't have to tell you how important it is to stick with it. Our health depends on emptying our bladder regularly. It's one of the ways that the body gets rid of waste. If you don't CIC as your health advisor recommended, it could lead to even more serious bladder and kidney problems. And since we're on the subject, let's take a quick look at how the urinary system works and why sometimes it doesn't.